So as the sinus surgeon in your group, how do, patients with reflux usually present for you? Are they having more, nasal symptoms or postnasal drainage, or what are you seeing in your clinic?
Yeah, the thing I always joke with people about is they just come in and they say, "Doc, I got sinus." And then we've got to dive down into like, what does that mean? But it's a lot of postnasal drip or postnasal drip chronic cough. It must be my sinuses, or patients with a lot of gram-negative, like recurrent sinusitis, or failing to improve with standard therapies after sinus surgery. And we dive down into, do you have heartburn? Do you have reflux? And for a lot of these patients, it's silent reflux. It's the laryngopharyngeal reflux. They don't have the heartburn. And then you've got to talk to them about like, well, you don't have heartburn, but that doesn't mean you don't have reflux. Well, I didn't get better on a PPI, so, I don't have reflux. And you're like, well, okay, but that only stops one aspect of the reflux. And so I work with a lot of them on that type of thing.
Yeah, I think that's really common in my practice as well, where either patients say, no, I definitely don't have reflux. I don't have that. I don't have heartburn,
Yeah.
Or they're like, well, I'm already on pantoprazole, or I'm already, I take that, because I have GERD or whatever it is. How do you think about reflux, like from a functional medicine perspective, or is it the same as we would think about it in kind of modern traditional methods?
Well, I think kind of the jaded allopath in me to a certain extent is a lot of people think reflux, you have reflux, here's a pill, right? Here's your PPI. Here's this medication that was originally designed to be taken for 6 weeks for an ulcer. And now we're just going to use it to treat your heartburn. And so that's not very functional. Or an H2 blocker, which at this point we're down to just famotidine. And so, but that's not a functional approach. That's not well, why are you refluxing? Is it a hiatal hernia? Is it your diet? Is it your weight? Is it bile salts? Do you actually have hypochlorhydria? Are you not actually making enough acid and now you just have an upset stomach and dyspepsia because of other things going awry? And so just throwing a PPI at people, I think, misses the boat. And so you've got to really approach these patients, where they're at in terms of like, okay, well, what are you eating? And like, what are your habits like? There was one patient, I was almost flabbergasted. He's like, no, my diet's fine. And the wife was like, you stop at McDonald's every morning and get 2 sausage McMuffins and like an Uber-sized coffee. And he's like, yeah. And you just kind of hang your head and realize, okay, well, we've got a lot to work on here.